I'm going to pull up Payton's bio here. So Diana Sullivan, unfortunately, she's got some events that have come up and she's not able to be with us or join us. Everything's good, just some work stuff that came up unexpectedly. So I will be introducing Payton Williams, obviously a wonderful, outstanding Rotarian. And hopefully all of this is correct. We've got somebody that can verify it or not. Payton was born and raised in Thomasville, left to get her BSPH in Health Policy and Management from the greatest place on earth, UNC Chapel Hill. She graduated in 2017, and after a year in West Virginia working for a home repair nonprofit, made her way back to Thomasville. She's worked at the Tompkins YMCA for a time before landing at Novant Health Thomasville Medical Center Foundation, where she gets to impact the health of our community and patients by raising funds for programs and initiatives that will save and improve lives. I've met with Payton personally about what they do at the foundation, and you know, she does not have an easy job, especially fundraising and being involved in the community during COVID times such as this. So give me a moment, we're going to welcome Payton as our guest speaker. Payton, if you'll give me just a moment here, I'm going to get things squared away. I'm going to get you pulled up here.
Can you hear me?
There you go. All right, let me get you pulled up on the big screen here, Payton.
Thank you, David.
There you are. Fantastic. All right, so are you able to share your slides with us? Is there a share screen, or do I need to make you the host again?
Oh, I'm good to go.
Okay, awesome. Go
All
ahead and
right,
share your
are you
slides.
guys seeing that presentation?
Yes, ma'am.
All right, I have to ask also, can you see my face or can you just see the presentation?
We can just see the presentation right now.
That's perfect. Exactly how I like it. Okay. Thank you guys so much for having me. This club has just been a huge blessing in my life. Hi, everybody. A huge blessing in my life over the last year since I came back to Thomasville. I really appreciate all that you do and for making me a part of it and for giving me this opportunity to speak. So I kind of get the unique job today of talking about a program that I did not come up with, but I'm super proud of. So I'm speaking on behalf of Blythe Leonard. She has been a fantastic board member for me this year as part of the foundation. And she decided that the way she wanted to make her impact as a board member is to raise money for mammography. And so we decided that October, Breast Cancer Awareness Month, would be the perfect time for us to kind of start this off. And she's probably the most creative person I've ever met. She's put together some really cool stuff. So I just thought that we could start with maybe a little trivia, and then we'll talk a little bit about what the foundation does to impact mammography in our area and what we're doing in October to raise some money. And a lot of you might already be aware of it because Kim's done a great job of putting it in the bulletin and David's been making announcements. So let's get started with trivia. All right. True or false? You can get breast cancer even if it doesn't run in your family. True? You guys are too smart for this. It is definitely true. I was kind of surprised by this. 85% of women who are diagnosed with breast cancer have no family history. I don't know if you guys can hear it, but they're playing the song that means the baby was just born at the hospital, which is my favorite part of working at the hospital. All right. True or false? Women over the age of 45 should have a mammogram every year. Do I hear true? Nailed it. Women with no family history should begin an annual mammogram program between 40 and 44, but definitely over 45. Women should be getting one of these every single year. True or false? If breast cancer is found at an early age, or that should say stage. If breast cancer is found at an early stage, you have a 98% chance of survival. True. Mammograms find cancer early before it can even be felt. And so when it's found that early, it is very treatable. If it's found later, the odds of survival drop to about 25%. Okay, if I had a mammogram last year, I really don't need to get one this year. Carol says false. No other strong opinions. Naturally, Carol's right. That is false. This blew my mind. Women who participate in annual screening after the age of 45 can reduce their chance of death caused by breast cancer by up to 30%, which is huge. All right, last one. Women without insurance are just as likely to get a mammogram as women with insurance. False. Nailed it. That is unfortunately very, very false. So only 30% of uninsured women have received a mammogram in the last 2 years, compared to 72% of women with private insurance and 58% of women with Medicaid. So if you don't have insurance and you go to get a mammogram, first of all, you probably have to go see a primary care doctor first to get that ordered, which costs money depending on where you go and who you talk to. And then you have to go get the actual mammogram, which can cost out of pocket with no insurance between $100 and $300. And then if something is found or if they have more questions, you have to go back to the doctor to get that read and to get that looked into further. So it can be very expensive. And so a lot of women who don't have insurance opt not to get them. All right, so we learned a lot in our last 5 trivia questions. The good news is that mammograms save lives. We know this. And most insurance programs do cover annual mammograms. The bad news is that thousands of people remain uninsured. So without insurance, the cost of a mammogram can be really, really high. And unfortunately, North Carolina has the 9th highest uninsured rate in the nation, which is not exactly a top 10 list that I'm super proud to be a part of. And in Davidson County, 13% of people between the ages of 0 and 64 are not insured, and that's from 2018. So that's a big issue where we live. But fortunately, we have the ability here at the foundation to kind of stand in that gap. And so how you can help is by contributing to the Remarkable Care for Oncology Fund. So we have a fund that is completely supported by people in our area. And all of this money, every penny of it that's donated, goes to providing mammograms for women in need. So we get referrals from Davidson Medical Ministries and the health department and other providers in the area. And we share information at other services that are provided for folks in the community. So women in Davidson County never have to go without a mammogram, which I love. And I think it's so important to know what your money does whenever you give it. And here at the foundation, 100% of our overhead comes from Novant Health. And so 100% of the money donated goes straight to these programs, which I'm really excited about. And so Blythe is a board member on the foundation. And when I was talking to Blythe, I was like, I want you to pick something as a board member that means a lot to you. And she said, breast cancer. And I said, well, this is perfect. How would you like to raise money for breast cancer? And she said, well, I don't know. Let me think about it. And the next day, she calls me and she's like, big pink chair project. Here's what we're doing. And it has been amazing. So a lot of you have probably heard about this already. Many of you have already participated either by donating a chair or by contributing to the fund. So thank you for that. What we're going to do is we're going to put pink chairs all over Thomasville. And these chairs, you can be bought by a business or an individual for a $100 donation, or like Rotary for $500, it can go downtown near the gazebo for the entire month of October. And on those chairs is going to be information for women to grab and go, to learn about how to get a mammogram, why it's so important. And then there will also be information about how to give a mammogram if you're fortunate enough to have insurance and it's not something that you have to worry about. So we're super excited about this. We've already raised $5,800 towards mammograms, which will provide 29 women with this service in Thomasville. So I'm thrilled. I think it's going to be really exciting. I can't wait to be driving around downtown and see all these pink chairs all over the place. I think it's going to be really cool. And I'm super grateful for Rotary's participation. I got to thinking and wondering about Rotary's lifetime contribution to our foundation. And so you guys have always been supportive. I don't think I've ever asked for support and it hasn't been given. So I pulled some stats, and since we've been keeping track of this stuff, so like probably 2000, Rotary's contributed $11,811 to the Novant Health Thomasville Medical Center Foundation, which Carol's clapping. I think that totally deserves some applause. That's huge, because every single penny of that, goes straight towards programs and initiatives for patients at Thomasville Medical Center. So thank you for that. I really appreciate it. If you ever have a question about what that money was used to do, it's probably mammograms, it's probably cardiac rehab, it's probably team member support. We have a chaplaincy fund that lets our chaplain buy and try out new programs for our team members who are in need of some extra support, which has been huge in the last couple of years. So we do a lot of really cool stuff. And I'm really thankful for y'all's support and your help. So thank you. The last thing I will plug is Pink Day, which is happening October 16th. Fairly sure that's the same day as the cook-off, the chili cook-off. And I think, somebody yell at me if I'm wrong, but I think it's happening right across the street. So Blythe Leonard is hosting this Pink Day at her new Makers Market. It's going to be from 10 to 3. She's going to have the mobile mammogram unit there, so women can actually go the day of to get a mammogram. You can call that number, and if someone's uninsured, they don't have to worry about it. They can still get a mammogram. She's going to have some treats. She's going to have a DJ. You can get pink hair extensions, which I think is why Pawpaw's going to be there. She's going to have pink products, pink art. I'm actually been working on this baby blanket today. I don't know if you guys can see it. To sell there. And so every bit of money raised that day is going to go straight into this mammogram fund. And so Blythe, being who she is, wanted to know how much it would cost to make sure that every single woman who came through our facility for an entire year who needed a mammogram got it. And it's about $60,000. And so that's her goal for this project, through the pink chairs and through the Pink Day, is to raise $60,000. And that will mean that no woman for an entire year in Thomasville or Davidson County who needs a mammogram has to worry about how they're going to pay for it. And the cool thing about this fund is that that follow-up care that we talked about you sometimes need after a mammogram is also covered. And so if a woman without a primary care doctor gets a mammogram referral from Davidson Medical Ministries and they find something, she can get a biopsy, she can get diagnostic imaging, and she can get follow-up care to make sure that she knows what her next step is. So we're not just giving mammograms and never getting them read or interpreted. It's really a full, complete cycle of care. So I think that's all I have. I've got my contact information here, my phone number. I clearly love to talk, so feel free to give me a call anytime. Again, Rotary has made a significant, I'm gonna stop sharing. Rotary has made a significant contribution to the foundation, and so you guys are definitely stakeholders. If you ever want to know more about what the money that Rotary has given has done for Thomasville, please reach out, because I would love to talk about that too. So yeah, I think that's all I have. Does anybody have any questions?
Questions for Payton?
Comments? Snide remarks?
That means you covered everything really well. There's no question.
All right. Well, thanks for having me. I really appreciate it. And thank y'all for all that you do.
Thanks, Payton.
David, I'm going to give you back the thing, maybe.
Awesome. So I will add, obviously, like I've said before, not an easy job whatsoever that anybody in fundraising has or in community involvement. And we just had a meeting this morning with one of our product partners about engaging clients, and it's tough right now. Well, Blythe has talked to me about the chili cook-off and about the big pink chair day, and you know that's one of there's several things that I mentioned I'm really passionate about. One is obviously everybody engaging with one another in social settings that we haven't done before, and bringing people together to do common good. And the other, like I've said before, are these larger events where we can collaborate with other nonprofits, with organizations in the community. And to me, there's power in numbers, right? So the more that we can have with Novant, with Blythe, with other organizations, CCM, we're making an impact locally that other organizations only dream of. And I don't know about you, I think it's pretty cool to be a part of that. So it is definitely a really unique opportunity. And if you're not getting pink hair extensions like Doc, then you can definitely, still go down there and check it out.